Labor Day is almost here. Maybe you have plans to travel, visit new places, or see friends and family. But how do we make this holiday different from the ones in the past that set us back? Joining me now live over Zoom is internal medicine Dr. Brian Lamb with Allegheny Health Network. Dr. Lamb, thanks so much for joining me tonight.
Thank you so much for having me on.
Dr. Lamb, are you worried that people will travel this weekend and we're going to see another spike?
I am. One of the things that we're worried about is every time we've had large gatherings, we have seen increases in numbers. We saw this in Memorial Day when things started to open up. Luckily for 4th of July, that was the weekend that things shut down again because we saw, this beginning of the surge in cases. And so we do worry because anytime you have a large festivity, when you have a holiday, when people get together, it's going to increase our risk of transmission of the virus and getting people sick.
What do you say to your patients who ask, can I travel and stay safe?
I tell them that it's a delicate balance. You can minimize your risk. So traveling itself does have some dangers. Anytime that you are around people, when you're in groups of people that you don't know, there's increased risk. But you can do the same things that you're doing now to try to stay safe. That is limiting the groups of people that you're with. So if you are traveling, the smaller the group, the better. If you're going to be at a cookout or a celebration, the smaller the group and making sure that it's people that you know, the safer you are. And then, of course, following the same social distancing protocols we talk about any other time. If you're in with a group of people, try to stay 6 feet away, stay outside, stay away from each other. You can still have conversations, you can still see each other and socialize, but try to maintain that 6 feet of distance and try to definitely do all the things that you normally would to be safe. And please, if you don't feel well, don't go. If you have any indication that you may have been exposed, please don't go out and expose yourself to other people.
Back in late June, you told my colleague Ken Rice, avoiding social interactions is, in your opinion, the best choice. Is that still the case now, months later?
It still is. Unfortunately, we know this is, it's a virus. It spreads by droplets. It spreads by aerosols. And it spreads by people being close together. And until we have a vaccine for the virus, avoiding social interaction is still the safest way to avoid contracting the virus or spreading it to others.
It's really hard. Do you feel like people are getting a little tired of it and starting to be lax?
I think a lot of people are at their limit. It's one of the things for everyone to remember is that as much as it seems like we've been living with this for a lifetime, it's only been 5.5 months that we've really seen the shutdowns that we've had in Pennsylvania. And I know people are reaching their limit. People want to see loved ones. They want to have fun. And I'm not saying that you have to isolate yourself in your basement with tape over the doors, but you have to be safe when you are interacting with people. We have a need for human interaction. We have a need to see those that we love, which is understandable. It's just a matter of doing it as safely as you possibly can.
Any place you'd go right now and feel safe without a mask on?
No, I will say that, especially anywhere in public. If you're in a small private gathering, yes, I could see if you may not wear your mask. If you are going anywhere in public, if you're going to any large event, and even with the with sporting events opening up, it's very important. Wear your mask when you're out amongst any group of people, people you don't know, people that you are not spending most of your time with on a regular basis anyway. Wear your mask. It's the easiest thing that we can do to help prevent the spread of the virus to ourselves and to other people.
Well, Dr. Lamb, thank you so much for taking the time to talk with us tonight. We really appreciate it.
Well, thank you for having me on.